So Aston, how was your week?
Well, I'd like to be able to say, as the first person ever, like actually, I've had a really chilled week because I've listened to you guys, and I can't. It's been an absolutely crazy busy week for me. We had a practice referral day, which I was kindly asked to MC at. So not MC as in host MC. So master of ceremonies, and delivered a lecture of that which I really enjoyed. And work was very busy, and family life has been busy. But all in all, a really good week. I was very tired going into the week. I was expecting to be totally broken by the end of the week, but actually, Friday went so well. As when we all lectured together, it went so well. I was so enthused by it, and I was so buzzing. As we talked at the end of it, I was like effervescent with positivity at the end of that. So that got me through it all. So yeah, it was a good week. Thank you.
Fantastic. So Ali, how was your week?
Yeah, good week but busy week. Yeah, as always. No, it was a really cool week because it's rare that we have a guest on that is part of our lives. Like we all are living this together. But what was really cool was Friday was a culmination of a 4-year journey for Aston and I. And it was a very pressured week, actually, in a really nice way. We don't often talk about the background to this, but I think it's a good thing to talk about now, where we had this referral day and we do an annual refers day, and it's fun and it's nice, and we get to hang out with all the people who send us all this great work, and we try and give something back in the way of we do a CPD event. We get it sponsored. So this year we had a £50 ticket to come to it, and everyone's donations went to Wells on Wheels, which I think is an amazing charity. Please look it up. Shaz Memon set it up, and I'd like to say a bit more about that. I think it's really cool that essentially a lot of girls in rural villages in India spend their day going to collect water for their family so they don't go to school. So they figured out a way that a family can get all of their water for many days in this wheel. It's almost like a well that is on a wheel. It's really clever. And what it's done is it's not about giving families water. It's given families education, because now the girls have time to go to school instead.
It's the time, isn't it? I didn't realize how small those little buckets that they carry on their heads, how little water they actually carry.
They don't get through the day. So that was really cool. But the pressured part of this is a lot has happened in the last year. And I think what's really cool is that we had our friend Mark flying from Ireland. I think he's our friend now, and he's from ESM, and he supplies a lot of digital equipment, and that's really cool. Saying Mark flew in. Mark flies in all the time. We really like him. It's a long way to come. But the big thing was that you aren't shouting about it, so I will. You're the first associate that we know of, maybe globally, who has bought a Modjaw, which, if people don't know what that is, it is an incredible piece of kit, and it's a huge investment. And you went to a Modjaw conference and you met a lot of people, and the suppliers for Europe were just really enthused by Aston's energy. They were saying to me, they flew over from Amsterdam, yeah, on Thursday to see the practice, to spend the day with you, to go for dinner with you, and then to come to our referral day on Friday. So that was really cool, because that's not a small thing to do, the team from Ostel flew over from Sweden to come meet me on the Thursday, look around the practice, go for dinner, and then come to the referral day on the Friday. So, we wanted to deliver something special, because people were coming a long way. And when someone comes a long way to see anything that you're doing, you want to, even though there's nothing in exchange for it, you want to give them a good trip. And but normally we'd spend the week just prepping for our talks, but we didn't have the week. We're hosting as well. So really, really cool. I think it was a really nice day. And actually, you were there, Flo, you spoke. And I think, if I'm allowed to say as well, Flo spoke on sustainability in implant dentistry and sustainability in dentistry in general. And you're on these on Welsh government committees?
More sort of NHS. It does tie into the government, yes.
And you have been giving talks on sustainability, and I've kind of been there from your first talk, and seen the evolution. And I haven't seen the last few you've given because you've been doing webinars for groups. And I thought it was just such a clever story and a really nice way to share things. And I just think the evolution of the team over the last year just blew me away. So I think Friday was one of my favorite days I've ever had. I absolutely loved it. Yeah.
I mean, it was incredible to sort of be, I suppose, because I was mainly just doing my talk, I was able to really then experience the day more also as a delegate.
Yeah.
And yeah, you both did absolutely incredibly sort of hosting and with your presentations as well. But the whole event really sort of flowed really well, and I think everyone there took a lot away from it. I think sometimes things are put on where it can feel again like you're sort of being sold to, but actually everyone went and yes, the information that you were able to come away with.
I think it was really valuable. It's valuable both for delegates, and we had a plethora of delegates from DCT ones that I'd lectured recently at in Landoc, who'd gone there and said, I want to come along and be exposed to this, through to consultants who've, it's not their first rodeo, they've been around for a little while, and actually just the feedback from the value that people took from it, and from industry as well.
Yeah. And we had ortho lab techs who own labs there to learn. Incredible.
And all seemed to really enjoy it and took a lot from it, which is the most important thing, isn't it?
Well, one of the coolest things I think was you were brave, Aston. You did a live Modjaw on someone. Which basically the computer decided to do an update.
It did a full BIOS update, like a deep system update.
And I could see the screen. You turned it away from the delegates. I could see the screen, and you were basically having to talk for as long as it was updating for.
But it's about dentistry, so actually,
give
me a stage and I'll talk about dentistry. Like it's.
It was brilliant, but I think what was really cool is I was like, everyone's going to get to see what Modjaw is about. I got to see what it's about, and I got to see the impact. And Maxi from Southern Implants was your victim.
She very kindly
and she was you got her to count backwards from 70, and I zoomed in. I was just videoing this for socials basically, and I zoomed in on the Modjaw screen, and I could see her teeth moving, and I could see everything. And I now know why the cases we've been talking about on the podcast, which, we send them to Aston and then they come back and then the teeth just fit perfectly together. You do stuff when they come see you.
Yeah. I'm not just sitting there chewing the fat.
Really.
Yeah.
I said to Aston,
there's actually work. I do work. Yeah.
If the computer doesn't work, just use some Obite. It will be fine. But this is different. Really awesome.
So before we crack on with anything else, let's just introduce Aston Parmar, who graduated from Leeds in 2010 and has been working in general practice in South Wales since then. He exclusively now just performs private dentistry, as it affords him the opportunity to pursue the highest possible standards of restorative and prosthetic dentistry. He is the first COIS-trained graduate in Wales and is currently setting up his sleep clinic focusing on treating sleep apnea. He achieves these great smiles by choosing the highest caliber international training courses, including a microscope-based reendodontic teaching by Godfrey Cutts and James Pritchard, a year-long accredited implant training program, and advanced one-to-one denture training by the specialist prosthodontist Michael Myint. Is it just Myint? Okay. As well as a restorative training with Maxim Belograd. And we are lucky that he works with us at NCDI. So,
thank you.
Why did you go into dentistry?
Why did I go into dentistry? So I always was very good with my hands. I always liked taking things to bits and rebuilding them and seeing how things work. And so I liked sort of doing like modeling, that sort of stuff. So I knew I wanted to do something with my hands. I had good hand-eye coordination, and I wanted something which was going to be able to, like, this sounds very like cliche, but I wanted to do something that I could like help someone with something or have some sort of impact. Also, I mean, truth be told, our family friend, sort of family uncle, was a dentist, and he basically explained about things that he wasn't trying to push me into dentistry, but he said just consider it, because he's like, listen, it's kind of a recession-proof industry. You're going to have some level or form of stability, perhaps more than some other industries. Obviously, it's not truly recession-proof, but it's, you know, that's one of the things that he said to me, and he's like, you know, when you've got a family and things like that, then it's stuff to consider. So that played an element into thinking, okay, it didn't force me into it, but it allowed it to stay on my shortened list of stuff to do. Also, I did a test at school, and I can't remember exactly what it's called now. It's been a few nights since I did that test when I was about 14 or whatever, and it came up as dentist or air traffic controller. So you know, all the planets seem to be aligning. My sister, who's 4 years older than me, she was going down sort of the standard medical university applications, you know, medicine, dentistry, veterinary, that sort of stuff. So she was doing the standard sort of A levels for that, and she originally wanted to be a vet, and then she kind of just did a sidestep and went into dentistry. And again, that created some exposure to it for me, and I was like, okay, this might be something that I really might be able to get my teeth into.
Nice. Talking about that, I remember doing those tests on what career you should go into, and one of my friends scored so badly on the spatial reasoning that they basically advised she shouldn't drive.
Is it a Moresby test? Is that?
I can't remember what it is.
I can't remember what it. Yeah.
But
Wow, Reek shouldn't drive. Oh, lovely. And how old? And this is before she would have had a license.
yes,
So
before,
just like,
yeah.
oh, okay, wow, Reek.
It's probably best you don't drive.
At least all of you knew not to get in the car with her.
True. She actually does drive now, so that's a little bit worrying. So you became a COIS graduate. For those that don't know, what is COIS?
So COIS is the surname of a dentist called John COIS. He is I believe, I might be wrong on this, but I'm pretty sure he's a triple specialist. So he's a specialist in prosthodontist and a specialist in periodontics, and they have a different type of speciality in the States where you're basically a specialist GDP. And he has set up an education center. He's based out in Seattle now, and he's widely regarded as sort of the highest level of dental education globally, or at least in the English-speaking world. And it's a training center, but it's geared towards science-driven education, and most importantly, independent science-driven education. So it's all verified to a very, very strict, very high threshold before they talk about certain things. It's not about trends and things like that, and it's not also influenced by certain other elements within our industry. They're trying to give you the truest and the best education, basically, without sort of other external influences. It's one of these things where people know if someone's gone and done COIS, because people who've done COIS tell you that they've done COIS. And it's seen as a bit of a cult, and it's something which, it's because it's such a powerful thing and it's such an incredible thing, you just want other people to go and do it. And it's okay if people think it's culty, and it's okay if people think I'm a bit nuts. That's all right. You know, we can discuss it when we're all retired and work out if it was a good idea or not.
It's because it changes you. People who go, it changes them,
I
the
want
way
that-
they see things.
I want to see that positive. It's had a huge positive change for me, and I would love to be able to see that positive change happen to others. And people who have gone and done it, they're all like, I get it, and they all then advise other people to go and do it.
So how did you hear about it?
So I first heard about it from a chap who'd done a small portion of the syllabus. It's modular. He'd done a couple of the modules, and then that was in my then VT. Kind of showing my age now. And I was of the age. Yeah, were you VT?
I was the first DF1.
Oh, okay, yeah, so I really am showing my
You're
age now.
old.
Yeah, I am old. And so that that put it on my radar, but I did some research. I was like, wow, this thing is really expensive, and none of this really made sense to me. So I didn't understand the value of it. I just knew that this guy had gone and done something in America, and he was telling everyone to go and do it. And that was as far as it went. And then one of my very best friends is a dentist in London, Dr. Sagar Shah. He actually got into dentistry because I told him to quit pharmacy. He was a qualified pharmacist. I told him, dump it, go back and do dentistry. And then he looked back and then he's like, you did me a solid, thank you very much. I owe you one. And then he went and did Cois. And he's like, oh, there's this thing in America, I don't know if you've heard of it. And I was like, oh, I heard about this thing from like 10 years ago. Was it the same thing? I did a bit of research and it was. And Sagar went out and he'd done the first 2 modules, and he phoned me in Seattle airport on his way home. And he was like, dude, you know that conversation you had with me sort of, 6-7 years ago? I'm having the same conversation with you now. He's like, just trust me. Don't ask questions. Do it. But you
Definitely
have...
a cult.
Or some kind of pyramid scheme.
Just do it. Wire me. Give me your bank details. So he said, just do it. And actually, when there's someone like that, and I've got that level of relationship with, I just did it. But he did say one thing: just know that you're going to do the whole thing. And and then he just left it. And then I think I booked the next day. And then I managed to catch up. My journey there was a little bit unusual, but ultimately we managed to graduate together, which was really cool.
Awesome. And how is it structured for people who are listening and thinking, I want to be working at the very top level of dentistry? How many modules? What's the path to graduation?
So there's kind of 3 general parts to it. So there's the main syllabus, which is made up of 7 modules. But actually some of those modules now are taken together in sort of back to back in intense weeks. And that changed around 3 or 4 years ago, where you used to have to go and do 7 individual visits to the centre. It's started to really spread its wings internationally now, and so they've started to bring them together. So it's ultimately less visits now. Once you finish those 7 modules, you're now a graduate, and that allows you to do the second part of it, which is to either carry on further and become a mentor and sit some exams, become a mentor, and you fly back out there and you help the next generation. And a lot of people want to do that because I kind of want to stop using the word culty, but actually people want to carry on helping, and so people, and so there's an incentive to do that, and it's not a paid thing or whatever. It's just go and give your time and help the next generation. So you can become a mentor, and the other element of that second phase is graduates are invited to their symposium, and every year alumni gather, and it's 5 days. I think it's 5 days, 4 days, or something like that. And they basically update all of the science that they've done over that last year. And so it's a full update. It's a huge networking thing. It's something which they've also got a whole social calendar for your children, for your partners. So they're trying to. It's basically.
This is a great cult.
It's a cult.
It's actually awesome.
So we should start calling it what it's actually is. It's not a cult. They actually have got a term for it. It's the tribe.
Cool.
So once you're a Cois graduate, you're part of the tribe,
Yeah.
and they really nurture and nourish that alumni, that tribe. So that's the second part. And then the third part is external education, but it's very, very highly filtered to. So people like, for example, Christian coachmen are like the only people who are allowed to go there and run separate courses and things like that. So they've got, and you don't have to be a Cois graduate or necessarily have done any of their education. You're allowed just to independently do some of that education. They have world leaders in composite mastery,
Yeah.
and photography and digital design, and they've got a lady there who now is actually part of their team, who is sort of like the most eminent digital scientist, basically dental digital scientist globally, who's called Marta, and she runs her own course, and so people are allowed to go out and do those extra modules as well.
Wow. So you've obviously done a number of these sort of really prominent courses. What sort of made you go down more of this course route rather than doing like a master's, for example?
So I'm not an academic. So when I left uni, I swore on my soul that I was not going to sit another exam for the rest of my life.
Aston, sorry, can we delve into this for a second? Because there's going to be people listening who have pretty much been in the position you've been in. So when you say I'm not an academic, what does that mean?
So I'm someone that I read very slowly. I've got a mindset where unless I'm really like enthused by something, even if I know that it's important, my brain just doesn't take it in very efficiently at all. There'll be terms and things like that you could diagnose people with, that sort of stuff, but that's just how my brain works. So actually learning from textbooks was woefully inefficient for me and my brain. And so I really struggled with that sort of stuff. So I didn't want to do it again. And so, sitting my synoptic exams in 5th year, I had to read a lot of books, and reading a lot of books was very, very difficult for me. And I hadn't discovered the passion for all of the nerdy stuff of dentistry at that point. Sort of, I had a little bit of a mindset of my aim is to get 51% in that exam, because some people could translate that, which I did at that time, as being that's the most efficient way to get through that exam. Like now I totally regret it, but I've got a much deeper passion for dentistry, which that might be an element to it, the fact that the university didn't give me that passion and didn't fire that up. But now I on reflection, that actually that library that I used to hate having to sit in, and it was a chore, was actually a library that was full of every single textbook of every single speciality, and it was a mine of data. And I'm like, that's so cool, there's so much stuff going on there. And it's a totally different mindset. So I've got a passion for that information in those textbooks, but still sitting there reading those textbooks would be really, really difficult for me. So that's the reason why I didn't go down the formal sort of UK hospital and academia-based sort of stuff. And actually, I left uni and I realized that actually most of the stuff that we learn at uni is actually not really relevant to necessarily becoming a successful dentist. I had some exposure from my sister, Charlene, who was older than me, so I was exposed to her friends and her who are dentists, and listening back to them. And so I kind of just didn't see the point of going back doing more sort of formal education. Actually, most of the stuff that we do as a general dentist is on the coalface. So I wanted to get good coalface skills, and I didn't really see that those skills were going to come from a textbook. So I went and found whoever was the best in whatever XYZ in the world, and I was like, well, I'll just go and learn from them.
I think it's really important that you have been able to identify sort of how you learn as well, because I definitely think that's such a key part. And it is really interesting because of the grade criteria to get into dentistry, I often think there's probably quite a few people who would be fantastic dentists, who, just because they don't really suit that GCSE A-level system, aren't able to go into it because of having to learn that way at school.
But even, you only have to go back 2 generations of dentists, and the people that were getting into dentistry were getting in as reset people with 3 Bs. And so, whereas now they're having to cull people with 4 As. So even their system, that they are still getting rid of, extremely talented people that for the hoops that they are currently setting, which happened, if they're saying, oh, you need 4 A's, they're still getting rid of people or not accepting people with those grades.
It's very much slanted towards producing academics, though. And the crazy thing is that if you had multiple interview parts to it, right, that anyone could rock up for an interview, and there's going to be a part that's academic, and it's not based on your grades, but you're going to sit there and have an exam. But then they're going to get you to put together IKEA furniture, right? Because that's more like dentistry. I may not have gotten in.
MMI station.
yeah. I just never get it. And then the third
You would have blagged it. You would have said it was abstract.
Yeah.
I've redesigned that furniture.
You could talk your way into anywhere, Annie.
But then
Or you would have ended up on the board of IKEA.
but then they have a third station where you then have to do that with either a stranger or a family member, and then they're testing whether you can get through life, right? But actually, dentistry is so many aspects, and you're filtering based on one. And yeah, I completely agree.
Who has inspired you most?
Ooh.
That also does sound like an MMI question. I just realised.
Who has inspired me? I mean, John Coyce is. You know when you're in the. It's happened to me a couple of times in my life, but not very often. But when you're in the presence of a true great. It could be the world's greatest tiddlywinks player, or the world's greatest basketball player, or the world's greatest academic. When you see someone who is hitting that 0.001%, those type of characters have a certain level of impact and a certain level of energy. And it doesn't have to be positive energy. It doesn't have to be, energy as we normally describe it day to day, but there's something about it, their aura. So being exposed to someone like that and listening to his story and things like that, that's a real inspiring thing. And yeah, I'd have to say that. And also I'd say my friend Saga. He's had a very interesting journey into dentistry, and a very sharp. Because he was slightly behind the curve in terms of age, because he went back as a postgrad. He threw the first 4 years of his life into education. I think he's done like 3 masters now, and Coyce, and he just threw absolutely everything in it to try and catch up. And it's not been like perhaps that wasn't necessarily the best way to do things, and he's learned that from reflection. But he inspired me to just knuckle down and focus on quality. So that was a really big influence.
Where do you want to sort of grow your sort of skills and things in the next 5 years, 3 to 5 years?
I'd like to develop better sort of financial planning and things like that. Okay, that's one thing which I see as an area of weakness, because that also then has an impact on my dentistry and the decisions that I make and the days that I work and all of that sort of stuff. So that's an important thing. I really would like to work on lecturing and education, delivering education. So I'm thinking in the next couple of years to maybe do some formal training in that. Cool. So that when I have the opportunity of being able to inspire or help someone, then I can be as effective as possible at doing that. That's basically that's where that's come from. And I'm now focusing my dentistry. It's gone from just solely focusing on quality to and introducing predictability. I feel like I've started to gain some stable momentum with that. So my focus now is actually looking at the human, not the patient, but looking at the human and seeing how much I can possibly help that person within my skill set. So that's what I'm looking at. I'm looking at seeing in different ways that I can actually help someone. Because we're not brain surgeons and we're not paramedics and so our acute ability to really help someone's life perhaps isn't as much as other industries, but we're still really lucky with dentistry that we can actually really help people. And in more of the far-flung corners of the dental world, we actually have an ever-increasing scope to help people, especially with the development of airway stuff and all that sort of stuff, which is really where I've sort of gone down. So that's where I'm trying to go with things.
How did you get into sleep medicine? Airway.
So 3 years ago, I was sat in a bar in yes, most of my stories start.
I was going to say.
3 years ago, I was sat in a bar with a plate of oysters and a pint of locally made IPA by a lake in Seattle with one of my now really, really good friends, and Mark Eilers, who's based out in Oregon. And we were just chewing the fat, and he mentioned this thing. This was very early on in the Coyce journey, so I think this was like day 3. So I was still like heavily jet lagged, didn't quite know what was going on, knew that I was just entering this world, and excited to know where it was going to go. Anyway, speaking to this American, talking about the differences, the nuances between the UK and America, both just generally and also within dentistry, and he mentioned this word airway, and I was like, I don't know what you're talking about. And because I'd literally never heard the term airway referenced to our industry at all, 0. And he laughed at me, like just straight up laughed in my face. And I was like, dude, I really don't know what you're talking about. And he's like, what are you guys doing out there? Like, how is it not? I mean, it's not heavily taught, but it's very, very overtly referenced, and people have a sound understanding that it's a thing for people to kind of know that they might want to go into it from undergraduate level in the States. And then over the next sort of 18 months of going backwards and forwards to the state, airway was coming up, airway, and I was like, I don't know a thing about this. And by the time I'd finished, I realized that actually in our diagnostic pyramid of working through a patient and taking as big a step back as you need to, which is a very different mindset to the UK, which is very focusing on that DO of that one tooth, that cavity on that one tooth. Airway is sort of one of the fundamental cores and one of the very early things that you need to sort of work through your diagnostic protocols. So I was like, I don't really want to be laughed at again. And I was like, also, the UK are decades behind on all of this sort of stuff. And the more I've spoken to certain people, like, for example, we both know Rory, who had gone and done some work out in Australia. And he's like, yeah, I mean, he'd heard about it over there. He had never heard about it in his training in the UK. And it's a thing in Australia. And people are aware of it. And there's some sort of system there. And so he's like, oh, it's really cool. You can help people. And so I was like, I need to do this. It's also part of the Coyce workflow. And so I can't just ignore it.
Yeah. It's all part of the cult.
It's all part of the tribe.
The tribe. I'm sorry.
It's all part of tribe education.
I suppose, sorry, this is a good time to mention that, like, kind of one of the patterns, I say this as someone who's been close to you through these years and seen what you've been doing. Your kind of quest for predictability, you knock down one barrier at a time, and this was the next barrier in a way, wasn't it? Like, you for the last however many years, it might have been that one of the early barriers was a bonding protocol, for example, and it's just been knocking them down.
At one stage it would have been.
Yeah.
Yeah.
So it's come about through this pursuit for predictability and for perfection. Pursuit for.
Yeah. Pursuit. Yeah.
So you're setting up now a sleep clinic.
Yes. It's going to be dedicated exclusively to dental sleep medicine, so airway medicine. So that should be launching sort of imminently. I've tried quite hard to not own a practice, which goes against the early sort of 20-year-old Aston's mindset, but I do want to have something which is my own baby as well.
Talk about that. Yeah, why? Why didn't you want to, and why do you need to?
Why? Okay, so I didn't want to own a dental practice. I do want to own my own business. I come from a sort of a business background with my family, and so I've got a reasonable understanding of it, and I think I could do a pretty good job of it. But up until 3 years ago, hadn't really met anyone that had done a good job of it, and I also hadn't really met anyone who was sort of like living a really good life as a dental principal, or at least not a life that I would want. Let's put it that way. My wife was always a bit like, why actually do you want to own a practice? Where's this thing like I want to own a practice by the time I'm 30? And the main reasons why people perhaps want to own a practice is because they perceive that they're going to earn more money, or that they're going to be able to treat the patients that they want to treat, so that all the good work per se is not skimmed off. They might want an asset at the end to be able to sell off, and that might be their pension pot or whatever. Or they have just generally had really rubbish practices and rubbish teams, and they want to build their own in their own vision. And then actually my wife really just started questioning me as to if that is actually the answer to achieve all those things by owning a practice. And within about 12 months, I'd completely flipped my idea that I'd had for the last almost 15 years into actually, why don't I try and cheat the system and be a successful associate?
I did not realize that this was the initial dream. I thought you had always been no way.
No.
As long as I've known you, you've been no way, right?
Yeah. No, it was head down, practice, and own and business. Well, actually, I'm a bit like, okay, you can still own a business. It doesn't have to be a practice. And so actually, that's one of the reasons why I want to do my own sleep clinic, because I need to just mildly scratch the itch of having my own business. And there's other things that I want to go into later on in my life that I will. But right now, it's not the right time. And going into a sleep clinic is because no one else is doing it. And it's really cool. And so I was like, yeah, why don't I give it a go? And it's something which I feel that I can try and engineer an element of dentistry, because ultimately it is an element of dentistry, without the typical stresses of owning a practice, or even just being an associate. It's something which is it's removable. At very worst, they can put it in the bin, or they can go back to exactly where they are. I'm not doing it, so it's totally irreversible. Sorry, the general treatments that I would normally be providing myself. So. Basically very, very high-end, very accurately titrated and long-lasting mandibular advancement devices, but ones which have been cleared for treatment for sleep apnea. Most MADs are not cleared for that use.
It's good to know.
And by ways of kind of a plug here, if people are listening, and either for themselves, their family members, or their patients, what are the kinds of things to look out for that might indicate that it's worth a chat about whether it's appropriate for someone to visit a sleep clinic?
Yeah, so it's something around 40% of the adult population have some form of airway, diagnosable airway condition, which is massive. It's something like 8% of people are actually diagnosed, and very few of those people actually go through and have successful treatment, because up until now the only treatment modality that's been able to be delivered within the normal pathways. It's changed within the last couple of years, but generally it's only been with CPAP, which are basically like these Darth Vader masks, and they've now got, like I said, mandibular advancement devices to such a high therapeutic threshold to be able to treat sleep apnea.
Mm-hmm.
So the type of things that people would, the type of people that would benefit would be people who have been already diagnosed and they've had CPAP and they've failed.
Mm-hmm.
There's a huge swathe of those people, so they know they've got a problem, but they just can't stick out the treatment that's been offered to them. And people who perhaps are on CPAP and they're getting on all right with it, but for example, they are going to be on a flight to Australia regularly, or not even regularly, but just generally there's going to be scenarios where they need something where they're not going to be able to wear their mask.
Mm-hmm.
A boys' holiday to Dublin or whatever, that's, whatever. And also people who are finding that they have a lot of chronic tiredness, and a lot of people put this down to it's just me,
mm-hmm.
or I'm going through the menopause, or
The rat race.
or I've got 2 kids, or my husband's sleep apneic, so that's the reason why I don't sleep well. And actually, 2 of those patients I've seen recently, one of whom her husband is sleep apneic, is on CPAP, and she actually has an airway problem, but she just thought she always had terrible sleep because of him. It's like, and another was my uncle. We were sat around having a drink, and he's like, "Oh, so what's this sleep stuff? What's this latest thing that you're doing?" Because every time I see him, maybe once every year, he's like, "You're doing a new thing," or what's it? He's like, "Come on, then hit me with the."
Making fun of Aston for his development.
He's growing as a person.
Yeah. Get back in your box. So I was just chit-chatting to him, and he's ex-military, and he said, "Oh, I get terrible sleep. Like I'm always always tired." And I was like, "Has this been like your whole life?" He's like, "Yeah, just military mind. Get up, sleep terribly, really, really tired, push through it." And he has a lot of the other comorbidities, cardiovascular disease and things like that. And a lot of these are they're bidirectional. So your diabetes, your periodontal disease, your cardiovascular disease, and so because they're bidirectional, you can actually really help these people. That's what I was saying, But so I said to him, right, I'll just post you a test when I get home. So he did a test, and he's properly sleep apneic. Like really, really properly sleep apneic. And I'm not going to go into like what his readings are because it probably might get a little bit too nerdy for a podcast. But yeah, basically he's got an issue and I can help him.
That's awesome.
And that's the most important thing. It's really cool. And so he just thought that was him.
And this isn't taking people who've been too shy to smile, or who, on a bigger level, we've helped a lot of people who can't chew and can't function socially. This is like changing everything for people, their lifespan, their quality of life.
Yeah. I'm basically going to be able to reduce people's hypoxic burden. So basically stop them from suffocating slowly, but suffocating a lot over a long period of time. It's like riding the clutch of your car. Yeah. And those sort of chronic low-grade stresses in that system. And yeah.
Wow. So, talking actually about those other cases, what are your sort of favourite type of cases to treat?
I like stuff that I have to use my brain on. I like finding, building a picture with a patient. Mm-hmm. So I like complicated rehabs. Mm-hmm. Yeah, I really, really enjoy that. I also like being able to do stuff for patients who they had been told, or maybe they hadn't been told, but they'd maybe just sort of come up with a decision themselves that they can't have something. So it tends to be more difficult stuff.
Someone who's been to a few places and
said, "Oh, this is impossible." And so, for example, there was a case that I saw lovely gentleman. He was missing all of his posterior teeth on the lower mandible, and he had had a couple of implants at the top, and he'd moved from Norfolk, and he's like, "Yep, I just need a denture." And I was like, "You don't just need a denture." He's like, "No, I've seen a guy who placed implants," and he took a scan. He's like, "There's no bone. I'm here for a denture, please." And I was like, "Okay, let's." Anyway, I think you saw him. I can't remember how, but ultimately I had a CBCT of him. I can't remember exactly the nuances of it. And I was like, I can really, really not give you a denture. And he was like blown away. That was such a powerful thing. And then it was quite a tricky case. And I used the Navident with Rob's help. So the 3D guided technology to help me, and it would have been a really difficult case to have used a traditional guide on, and also unpredictable. And yeah, I mean, I planned the case. It took me about an hour to plan it. Used some quite advanced features of the Navident that Rob really loved, and he's like, when we saw him this week, he's like, that case, we need to talk about it more. We need to let people know that, because it was, I think, one of the first times he'd used some of those features, and it was incredible. And totally flapless, and managed to change that patient's life in the space of an hour and a half of surgery and a half an hour chat in the chair. And he'd been so convinced that things weren't available to him. And luckily now, with the technology that we have and the team that we have, we were able to hit those higher numbers of percentages of treatments available to patients, which are really, really helping them.
I want to bring up another case that you treated, actually, because I think that's really cool, but that's cool from our side. But the impact I've seen you have, there was a retired DCP who had been through treatment with specialists, full mouth rehab treatment with specialists, was having big problems with her TMJ, and she'd not just been through like some of the best private practices in South Wales and had treatment, but then when she was having problems, she had been through the whole of the dental hospital in Cardiff, and
then referred through to psych as well.
So, and this is the thing, they got to the end of their clinical diagnostics, and it was being basically she wasn't being gaslighted, because they genuinely believed everything was fine, but this was really impactful for me to see, because she came in and I met her, and then I said, this is way beyond the restorative complexity that I can even fathom, and I sent her to you, and you figured out what the problem was. And this is the hardest part of dentistry, is the diagnostics. If you don't get the diagnosis right, it doesn't matter what you treat. And essentially, you strip back all of the restorative work and did it differently. And this is, you got the diagnosis, you treatment planned it, and you delivered what was needed. And her life changed. And she's such a lovely person, and she's so grateful. But that, someone who's being told that they have a psychological issue, for them to have their physical pain taken away, that's just mind-blowing. But that can't happen unless you can carry out all of that. You have to be able to diagnose, you have to be able to treatment plan and to communicate that treatment plan, and then you have to be able to deliver on the clinical dentistry. You can do all of it up to that point, but if you can't stick stuff in properly, it will not work. And it's odd, because that's actually the last thing that you need on that journey, but it's the only thing that we learn in UK education.
Even a lot of postgraduate education is all about the end bit.
Do you have any hobbies for sort of that work-life balance?
I do. My work-life balance has taken a bit of a shift, a bit of a decline over the last sort of year or so, but that's okay. Like, it's a conscious thing. It's not out of control. But I've needed to prioritize other things, and so that will pick back up again. But yeah, generally, I got a passion for like motorsport. You're not going to like this, but generally anything that burns a hydrocarbon, be it cars, bikes, planes, whatever. And sorry, Flo. And I'm really into bees. But that's one of the things that I've had to sort of put on a back burner recently. But yeah, I'm a beekeeper, and my daughter was becoming a beekeeper as well. And my son, I haven't been doing it enough recently for him to have had a go. It's probably a good thing actually, because he's the kind of guy that would really just go in there and annoy them. They're not the kind of things that it's like keep them as your friends. And teeth generally is a real passion of mine. It's a real hobby. And whiskey. I can have a real nice nerdy chat with someone about whiskey. I quite like that sort of nerdy stuff. Like I like getting into the minutiae of bits and bobs. So I've got an old car that I treated myself to in my VT. I basically spent my entire VT wage on this car. So at this point, like I had a nicer car than the lecturers in my VT, and it was my dream car, and I'd had it as my screensaver on my computer at uni, and that was a real energizer for me to get up at 2 o'clock in the morning. That's what I used to do. I used to study in the night. So I'd get up, ridiculous hours, go to the library, work, so I wouldn't be distracted. There only needs to be one little thing in the room to distract me, and then I'm off. So no one is distracting anyone at 2 o'clock in the morning, because no one's doing anything. So yeah, I had this car, and I used to do a lot of advanced driving, and I used to do a lot of track driving and things like that. And anyway, it's been out of action for the last couple of years. So this is my thing. As soon as my balance gets better next year, and it will do, I can see how it's going to happen. So that's okay. That's my next project, is to really reignite that passion. And I want to take Ali out in that car, and I want to scare the pants out.
I was scared driving around in your Citroen around the corners. I don't know what's going to happen to me there.
Yeah, there's two people that I can imagine are going to have a very similar reaction. One was my mother-in-law the first time she got in my car, and one will be you.
the two fragile old ladies that you know. Aston, I'm going to put you on the spot here, because I think it's actually your kind of personal journey has and your personal growth has been so big over the time that I've known you, that is there, if you could kind of choose one or two bits of advice to give yourself 5 years ago, if you kind of time traveled and you had 10 seconds and you had to blurt it out and you come back, what would you say to yourself?
I would say that it's really, really important that you find yourself someone in your industry to really collaborate with, have your back, help you develop, work off of each other, and allow yourselves to both grow with each other. and that's actually that's what happened, and that's how we became really good mates, and that's been the thing that's allowed me to develop my career and develop as a person, and perhaps you might feel the same as well. And
absolutely, I have to say,
to bounce off of each other.
The journey we've been on together has given me freedom, because what's happened is the things that you do, like the cases we've just talked about, you do them to such a high standard that sometimes, we in the beginning, a few years ago, you used to come to speak to me about cases. I wouldn't even be listening. And then I one day I said to you, Aston, I don't want to talk about these cases, because you know what you're doing. You're so far beyond in this clinical journey in the restorative side that I'm not even going to think about this stuff. That it's a waste of my time and energy thinking about it, and I'm going to go down a different route here. And that's been incredible, because I've got to explore things that are my passion. But the thing is, the things that you've brought to the table that you're achieving absolute predictability on are things that I would have been forced to have as part of my journey, because a lot of my clinical work is very dependent on you. All of the full arch work that we do, the workup is done by you, the teeth are planned by you, the teeth are delivered by you. And the funny part of all of this is that you do full arch work. It's kind of come to a point where I'm delivering the things that you don't have time for over here, which I love, and you are the architect, and sometimes you could be the architect and the builder, but that's actually a waste of your time, and I think people don't really fully grasp and understand that. But yeah, I absolutely fully feel the same. And for the record, I don't say this much because we joke we need to not let Aston get a big head, but the fact is that it's good to not keep saying these things because it keeps us all striving. But I have to say, you are the best dentist I've ever worked with, and I've worked with great dentists. Like you know the people that I've worked with, and it absolutely from ability to diagnose and plan, but actual delivery. And I think Flo will attest to this. How often do we have someone come in with something that has broken or is hurting? And Aston does a heck of a lot of work. Like, you do a lot of restorative work. And I think, the proof is in the numbers. But yeah, I concur. It's an absolute privilege to work with you, man. And I don't say that too often.
Well, I mean, what can I say? That's amazing. It's very humbling. Thank you. I mean, just to really go back to that question that you said, it's I would advise people just don't do the journey on your own.
Yeah. Well, we all have each other. That's the nice thing here. Yeah, find your people.
So before we let you go, we're just going to do the quick fire quiz so that you can earn your dental pearl. There's not actually a pearl, but what is your favourite procedure to do?
My favourite procedure is actually new patient exam, first hour, diagnostics.
Wow.
Chit chat for an hour, work out what's going on.
What is your favourite scrub colour to wear?
I do like dark blue. I do like dark blue. I think it's my favorite. I've tried light blue and black and grey, and I think dark blue.
Nice. With no context, which is your favourite tooth?
An upper six.
Nice.
No context. Sorry.
Aside?
So it's got the largest ripple effect for everything dental. I'm not going to go too much, and this is like a 3-hour lecture, but basically it is the most important tooth in your head.
You should do a lecture on that. That's just quite interesting. And if you had to start again, what would you like to do?
If I went back and had to start again as a dentist, I would consider going into the military. Mm-hmm. I originally wanted to be a fast jet pilot when I was a teenager, and didn't go down that path. And then I got into uni on the basis that I was going to join the RAF. Actually, that was like discussed in my interview, and one of the guys that was on the panel was the military liaison officer for University of Leeds and things like that. So I was really quite passionate about going into that. And then I met my then girlfriend, now wife, and she was a forces child. Both parents had been in the RAF, and it was basically a very, very clear early on as like, I've been a forces child, I'm not going to be a forces wife. So that got poo-pooed real quick. So yeah, I think I'd see how that might have turned out, being a military dentist.
Fab. Well, thank you so much for coming on today. There's been a lot to digest there. It's been fantastic listening to you talk there. So thank you.
Thank you, Aston.
Oh, thank you for having me. I've really enjoyed it.